Hi, my name is Dr. Karen Nater-Pineiro. I'm a neurologist. I work right now with First Choice Neurologist. Have an office practice in Davie, Florida. And I specialize in multiple sclerosis treatment. Did my fellowship at the University of Maryland. Then went up and worked at the Cleveland Clinic Foundation. And now I'm here in South Florida serving the multiple sclerosis population. So I'm going to talk a little bit about that. What is multiple sclerosis? That's the first question. So multiple sclerosis is a demyelinating disease. It means that the myelin sheath, which is the layer of fat that surrounds our nerve, gets damaged, and it gets damaged by our own body. It's an autoimmune disease. That is the basics of multiple sclerosis. When you're diagnosed with multiple sclerosis, a lot of questions come to you, or you may have read or know someone with multiple sclerosis, and you wonder what symptoms you could be having or what symptoms you may have in the future. So multiple sclerosis can present in very different ways and at very different stages in life, but most times it comes in the 20s to 30s years, and you can have an episode where you suddenly lose your vision, or you can have an episode where you are weak on one side, or you're having some what we call paresthesias, numbness, tingling, sensory changes. Those are sometimes harder to diagnose because it gets confused with different other processes that can cause sensory changes. You can have symptoms of urinary incontinence, for example. Other times you have more vague symptoms like generalized fatigue or sleepiness, and as you can see, those can be misdiagnosed, and it can be present on other disease process. So when you have the constellation of symptoms, that raise a flag to the physician, and they tend to obtain an MRI of your brain. The MRI then comes back and it shows some abnormalities that we call white matter changes in particular areas of the brain that have been described on patients with multiple sclerosis. Now at that time, you may already have what we call fulfill the diagnostic criteria, and we then start talking about treatment. Some other times, you don't have enough information then, and we may need to pursue other processes or other diagnostic ancillary tests, and we may order a spinal fluid analysis, or we may order a visual evoked potential, or what we call OTC, which are optical tomography. Okay, so from then on, you will have a conversation with your physician about what you can expect and what is the best next course of action in terms of treatment.